Mr. President, reserving the right to object, let me just say that over the last year, we heard constantly that you should, quote, stay home when you are sick. It's good advice, of course, and the right thing to do for public health, and I certainly encourage people to do it. But what I thought about every single time was, what about the workers who can't just stay home? Because there is a lot of them. Right now, 32 million American workers do not have access to a single paid sick day. Let me repeat that. 32 million people in the United States will lose pay if they stay home because they are sick or because they have to care for a sick loved one. And only 20% of private sector workers in the United States have paid family leave through their employer, meaning millions of workers will lose pay if they give birth or have a sick child, for just a few examples. What I hear from workers in these situations is they need to know they have the ability to take time off without worrying about losing their paycheck and without worrying about whether their boss will allow them. That's why I'm on the floor today to object in the strongest terms to the misleading titled bill the senator from Utah just proposed. His bill will allow employers to offer workers comp time instead of time and a half pay when workers put in overtime. Now, here's why this won't work when it comes to taking paid leave. Under this bill, the so-called Working Families Flexibilities Act, workers would have no guaranteed right to use the comp time they've earned even when there's an emergency. And it actually gets worse from there. Under this bill, if a worker's claim is denied, their only option to fight back is to request their comp time be cashed out, and the employer has a whole month to comply. Mr. President, as of March 2021, more than half of Americans said they were living paycheck to paycheck. A month is not going to work for them. Anyone who is serious about making sure workers can support themselves and care for themselves and their families should reject this bill and work with my colleagues and I to pass Senator Gillibrand's Family Act and the Healthy Families Act Congresswoman DeLauro and I introduced. Our legislation would actually truly give workers flexibility and a weight off their shoulders as they navigate the kinds of tough times we all encounter in our lives. Because look, when this pandemic struck, we saw how costly not having paid leave has been for our workers, for our families, for our businesses, and our country. Millions of workers were forced to choose between the well-being of themselves and their coworkers and their families or their paycheck. Millions were infected, and millions more, especially women and workers of color, were forced out of their jobs in large part due to lacking paid leave or quality, affordable childcare options. This pandemic has really made it more clear than ever. It is far past time we make paid leave a right for all, not just a privilege for some. Now is not the time for more false choices and stress for our workers. It is a time to get real solutions over the finish line. So I object.
Objection is heard.
Mr. President.
Senator from Utah.
Mr. President, it's unfortunate that the Senate won't choose to make available to private sector workers options that are already available to government employees. And just to reiterate here, under this legislation, employers are not required to offer it, employees are not required to take it. This just eliminates the vestigial remains of labor laws passed decades ago that deny workers and employers this option. They keep that open for government workers. That's discriminatory, it's unfair, and it ought to end.